So I am super excited to chat with Dr. Jill Carnahan, who recently released and really an amazing book. I listened to the audiobook and it's called Unexpected. We're going to be talking about Unexpected, which Dr. Jill goes in detail about our health journey. And so let me go ahead and dive into Dr. Jill's impressive bio here. So, Dr. Jill Carnahan is a board certified integrative holistic medicine specialist, known as your functional medicine expert, and often referred to as the Sherlock Holmes of medicine for solving the case of the most well known medical mysteries. Utilizing state of the art lab testing and biochemical analysis, she helps each patient identify the root cause of their illness by identifying nutritional or metabolic imbalances that may be contributing to their symptoms. Dr. Jill uses nutritional protocols and supplements, lifestyle changes, and medication to increase patient levels of function and always seeks the gentlest and least invasive way to restore health and optimize healing. She has also sustained a 5+ year waiting list as the medical director of Flatiron Functional Medicine, a widely sought after practice. As a survivor of breast cancer, Crohn's disease, as well as toxic mold illness, Dr. Jill brings a unique perspective to treating a variety of complex and chronic illnesses and has traveled the world sharing her knowledge of hope, health, and healing live on stage, as well as through newsletters, articles, books, podcasts, social media. And her memoir, Unexpected, is out now, and that's what we'll be chatting about. So, again, thank you so much for joining us, Dr. Jill.
I am delighted to be here. Thank you so much for having me.
Yeah, just again, I really enjoyed again listening to your book. Just it's was great listening to your health journey and and even beyond your health journey because you discussed you had a divorce, which I just saw I think it was this summer you actually interviewed your ex-husband on your podcast on.
Yes, yes, we have a lot to say about how do you have a healthy relationship. He's in another relationship and, engaged, and I'm so happy for him. But it transitioned to, we always say we didn't do marriage so well, but we do business well, and we've gone on to be great friends. And that's so needed in our world, is just forgiveness, and how do we connect with, or reconnect with other relationships that have changed over time.
Yeah, no, that is awesome. So again, you've been through a lot. Breast cancer, Crohn's disease, toxic mold, getting a divorce. And this really all started when you were young. Just according to the book, you were brought up on a farm, you were exposed to pesticides, took antibiotics, had your tonsils removed. And people really, a lot of people don't tend to think about these things. As practitioners, we do, and we try to go back. And I ask people commonly about antibiotic use and other things in childhood. But so you think, I mean, you're pretty confident that that played a big role in breast cancer, in your breast cancer diagnosis, maybe even Crohn's disease later on?
You and I, Eric, this is part of the beauty and the curse of medicine and being a medical detective, right? Is like I have, ever since I had breast cancer at 25, was like, why? Why did that happen? So my last 20 years have been spent really going to the deep dive of saying what factors contributed to my illness, because what it's allowed me to do, and again, you've had the same kind of journey, is really look at root cause medicine and what things contribute. So I have no doubt that probably even in utero exposures to chemicals, pesticides, and things from the farm. And then when I was young, a lot of these things are endocrine disruptors. Now, this you may not know. I don't know if I mentioned in the book or not, but my sister, who she also had thyroid cancer. So I had breast cancer at 25. She had thyroid cancer at 28. Two girls, same farm, both endocrine related cancers. So to me, that's even more evidence that, yes, genetics probably played some role. And in my mind, genetics played the role in poor detox mechanisms, and then the environment on the farm. And again, this is just anywhere, because nowadays rivers and streams and pesticides are all over the place. But of course, in the farm environment, there's lots of those. And because they're endocrine disruptors, that just means they act like hormones on the body. They can disrupt thyroid, they can disrupt prostate for men. And so at 25, I was diagnosed with cancer. And I think it's kind of this, looking back, hindsight's 2020, and we can start to see the patterns. And then what it's allowed me to do, again, same as your work, is to look at patterns in my patients and say, what of your lifestyle right now could be contributing to your chronic illness or to potential future diseases? And how do we reverse that?
And then also the diet, because you also were a vegetarian for quite some time. I think just as a teenager, and it wasn't a healthy vegetarian diet, as you explain in the book. You were eating like pasta and bread,
Carbitarian,
and
yeah.
exactly. So
Yeah,
I'm
so
sure
that
that also didn't help.
and that I want to speak to because I think it's so interesting. Again, in hindsight, I never really liked. I grew up on a farm, so it was like steak and potatoes, right? Like it was a heavy meat diet, and I realized right away I didn't. Very young, I didn't feel very well. And looking back, I think I was low stomach acid, so hypochlorhydria, which leads to difficulty with breaking down meat, so it doesn't feel very good in your stomach. And then I was also zinc deficient and B12 deficient, two things that are pretty critical. And I think when we know about zinc deficiency, it can cause a lack of desire for taste of meat, or kind of a, you don't like the taste of meat at all. And so I think those things kind of contributed to me deciding, oh, maybe I don't need meat. And then of course I wasn't really schooled on what's a healthy vegetarian. And I was 14 years old when I stopped eating meat. And so what I did was I gravitated towards carbs. So, and processed kinds of things. At the time, all I could get was processed soy, kind of fake meat products. And I joke because I say it almost killed me, because up until I was 25 and diagnosed with breast cancer, I was really not eating a great diet. I had, unbeknownst to me, celiac. So I was eating a lot of gluten, didn't know that that was contributing to inflammation, lots of breads and pasta, and just not a great way to be a vegetarian. Nowadays, again, there's some people I feel like can do well with that, but you have to be very, very deliberate about how you get your B vitamins, how you get your protein. And I certainly from 14 to 25 was not deliberate.
So you were a vegetarian until the breast cancer diagnosis?
Yes. Yes. So for almost a little over 10 years, I was a vegetarian from 14 to 25.
Oh, wow. And after your diagnosis, was it a pretty quick change, or did it still take some time, like years later when you started making dietary changes?
So basically, I become a vegetarian. And what I also didn't know, I was severely B12 deficient. I have some genetic mutations and ability to absorb B12. And then, of course, you take out the main source, which is meat. So vegetarians, vegans are at risk of low B12. Most of them supplement because it's hard to get enough B12 in a vegetarian diet. That's one of the things we always think about. Again, I didn't know this. I was zinc deficient. I was low stomach acid. And on top of that, I was silent or undiagnosed celiac disease, which means I was already having atrophy of the absorptive surface of the gut. So I was basically going into this kind of malnourished. And then that particular diet for me did not help at all. And then I get diagnosed with breast cancer. So I started to look at diet again, didn't make a huge change then, but what happened, got through chemo, 3-drug chemotherapy, which destroyed my gut. So my already kind of gut that wasn't super stable went to a really bad state after the chemotherapy. And within 6 months, I started having gas, bloating, abdominal pain, bleeding, all kinds of symptoms, weight loss. And I remember one day I'm in the ER helping a patient with getting their blood pressure, and I literally passed out. I was taken into emergency surgery for an abscess, for probably sepsis, early sepsis. And I woke up the next morning with a surgeon saying, "Jill, you have Crohn's disease." Now, for anyone who doesn't know what Crohn's disease, it's an autoimmune disease where your body attacks the gut lining. And you might be like, well, how weird that you had breast cancer and then Crohn's. But let me tell you, here's the story. So I had this undiagnosed celiac, so already a damaged gut lining. The chemotherapy that I took, especially Cytoxin, cyclophosphamide, has been known to damage the permeability, the membrane that lines the gut. So it basically induced a much more severe form of leaky gut on top of my already undiagnosed celiac disease. And then I had this gene I didn't know about called NOD2, which makes me higher risk of developing Crohn's. And in this case, all it was a hyper responsive action to the microbial contents of my gut spilling through the leaky gut into my bloodstream. And that actually literally contributed to the Crohn's. So in my mind, it's the perfect storm. Undiagnosed celiac, poor nutrition, B12 malabsorption, probably dysbiosis, meaning abnormal microbes in the gut. You take a drug like chemotherapy that causes more permeability, all of a sudden dumping of the bacterial coating in someone who's very susceptible to this autoimmune reaction. And bingo, you have Crohn's disease. It kind of makes sense, doesn't it? So then the Crohn's was my opening of the door into diet changes, because I sat with a gastroenterologist after I found my diagnosis and said, what does this mean? He said, lifelong medication, probably immune modulating drugs. You may need surgery to remove part of your colon. I mean, he was very depressive with his prognosis. And the last thing I said as I walked to the door was, "Doc, I want to do whatever I can. Can I change my diet? Is there anything I can do?" And he said, "Jill, Diet has nothing to do with this. And I knew in my intuition that something didn't seem right about that, even though I had no knowledge of the nutritional background then. And I started to go on a search to find answers. And that's where I came across that diet could potentially have something to do with it. I changed my diet. I got rid of the gluten, all the processed foods, completely revamped my diet. And within about 2 weeks, my symptoms of bleeding and pain were gone.
That is awesome. And yeah, it's sad. Even today, I mean, I get countless patients telling me, that the endocrinologist told them that that diet doesn't play a role.
Yeah.
Most of the people I see, Graves and Hashimoto's, or sometimes non-autoimmune thyroid conditions, but still, they could be, even if they don't believe that diet is going to play a role. To me, it's why can't they just say, well, it's not going to hurt to eat a healthy diet, so you might as well give it a try. But just to dismiss it, that no, diet's definitely not going to help with Graves, Hashimoto's, in this case, Crohn's disease and other conditions. So yeah, that's I'm glad you made those dietary changes. And you mentioned silent celiac, because a lot of people, when they think about celiac disease, they think, well, hey, I eat gluten all the time and I feel okay, so I probably don't have celiac disease or non-celiac gluten sensitivity. So you weren't experiencing symptoms for a number of years.
Well, in hindsight, I look and I'm like, oh, of course, I had severe eczema and skin issues, which usually relate to leaky gut. And so I definitely had some probably intestinal permeability. The zinc malabsorption, the B12 malabsorption are both common with intestinal inflammation. And again, I didn't know that until later. And just even like, I was very tired. I pushed myself hard. So I don't think I complained or realized how fatigued I was, and probably from that B12 deficiency. So looking back, there were lots of signs and symptoms that were kind of leading up to that. And I like to tell my patients this. So if we check the genetics, there's a DQ2 and a DQ8. These are the high-risk genes for celiac. You can ask this for your doctor, and it's very relevant to thyroid disorders, as you well know, and I'm sure I've talked about. So if you have those genes, even a half copy, even if you never in your lifetime get celiac, I think the lifetime risk, the average age of diagnosis of true celiac is 55 years old, which means, as we know with autoimmune, you need a genetic predisposition, which is that genetics that I had as well. You need an environmental trigger like gluten over time. And then you need that in the case of a permeable gut. So those three things, when they're present, that's kind of the triad of autoimmune disease at the root. And this is celiac is a great example. So say I have a patient in front of me who has a DQ2 gene, which is a high-risk gene. I say, okay, you could go your whole life and never develop celiac disease, even though you're maybe 13, 20% more risk. However, I think of it like as a wagon wheel, and the center of that wagon wheel is your gene. And one spoke is celiac, but the other spokes are Graves and Hashimoto's and rheumatoid arthritis and Crohn's disease and lupus and multiple sclerosis. And I could name any autoimmune disease and link it to that predisposition, because we know that autoimmunity can come from that permeable gut and that constant barrage of microbial contents on the blood, on the immune system, creating inflammation that eventually ends in the body attacking itself. And it can attack nerves in MS, it can attack the blood system in lupus, it can attack joints in rheumatoid arthritis. And any one of those things could be the outcome, even if you never get celiac. And I say that because then a lot of people are like, oh, so you mean if I avoid gluten right now, I could potentially prevent myself from getting Graves or Hashimoto's or lupus or arthritis? And I say, yes, there's no guarantees, but you're definitely going to decrease that risk. So if I could go back to my younger self and know all of this, I certainly would have done my diet differently at 14 years old.
So you test the genetics for celiac disease for everyone. Do you also do a celiac panel if they're eating gluten?
Yeah, so the genetics are just your predisposition that you came into this life with. And like I said, the relevance is so important. I was shocked by this statistic that the average age of diagnosis of celiac, it's not childhood, it's 55 years old, which that's a lot of decades of a barrage of the immune system before you actually become full-blown celiac. And if you think of the lining of the gut like the shag carpet in your 70s bedroom or whatever, that shag carpet starts to get ruined, and you don't have true celiac until it's almost down to like a hardwood floor. So it's a lot of damage that has to happen for celiac, and you can have anywhere in between where there is lack of absorption, like in my case of B12 or of zinc or of other minerals. And you can have manifestations of fatigue, or even I think there could have been a connection to the cancer. I don't think it was causal, but that whole immune inflammation, immune dysfunction certainly didn't help me fight the cancer cells in my body. So in hindsight, I look back and say, oh, all these things. And I think it's relevant to tell the patient, this is your risk, and you have a choice today at 25 or 35 or 45 to change the trajectory of your illness. And if you know that, you can shift. Now, what you ask about is the celiac panel. So in addition, which I also do that, you can test for anti-gliadin or anti-deaminated gliadin antibodies, IgA and IgG. IgA is the mucosal lining, so that's an early responder, and IgG is systemic immune system. And I do that as well, but that, if you see that happening, that could either equal a non-celiac gluten sensitivity, where they don't truly have damage to the gut, but they're starting to have this very significant immune reaction to gluten, or it could mean that they have full-blown ruining of that shag carpet or damage to the shag carpet that's leading to malabsorption and symptoms. And it's so core because I really believe that so many autoimmune diseases begin with part of this inflammation with our diet.
And my guess is if you do testing, let's say the genetics are negative, celiac panel's negative, and it's an autoimmune patient, do you still have them avoid gluten? I'm thinking you do, just because it can affect the permeability of the gut and lead to other problems.
So I remember when I first dove into the research, because what you're saying is basically you could have someone who comes in who has no celiac genes and no antibodies. So there's no known documented inflammation going on in the body. But like you just alluded to, what happens is every single human postprandial, that means around 4 hours after we eat, with the consumption of gluten, it increases all of our permeability. Now, if you are perfectly healthy, you have no sign of autoimmunity, you have no joint pain, no brain fog, you feel amazing, probably not a big deal. But I don't know about you, but for me, the patients that come to see me are not that class. They have multiple autoimmune diseases, sometimes chronic complex disease, sometimes unexplained brain fog, migraine headaches, joint pain, etc. And thyroid disease is rampant, right? I would say probably 8 out of 10 of my patients have hypothyroid, Graves, or Hashimoto's, or some form of thyroid disorder. So because, at least for me, that's not the population that I see, I really ask almost all of my patients to be gluten-free, most of the time dairy-free, and sugar-free. That's kind of the core. I'm sure you do similar.
Yeah, I was actually going to ask you about dairy. So you do have them avoid dairy, gluten, sugar. And do you currently still avoid dairy? I know you avoid gluten, but dairy permanently, or do you sometimes have some dairy?
No, I am really, it's been plus 20 plus years now, but I am very, very stringent on my diet because I just feel so good when I'm eating clean. I am 99% grain free. Maybe twice a month, I'll have a little quinoa. That is literally the only exception, and completely dairy free. All cow's milk dairy of all sorts, types, dairy free. All sugars, free of sugar. Trying to think what else. I don't do a lot of nightshades, and there's a few other odds and ends. Soy I don't do, corn I don't do. And I've kind of gotten to be, years and years ago, this is a whole nother story I won't go into, but I definitely had significant bacterial and fungal overgrowth in my gut. And part of my healing completely from Crohn's was dealing with that. So specific carbohydrate diet or candida diet, these are two separate diets, but they're some of the ways that we decrease those microbial overgrowths in the gut. And so I kind of found years and years ago that those diets worked. So kind of a low glycemic, low grain type of diet. And again, soy and corn aren't horrible, but in the US, they're so often sprayed with glyphosate. They're so often triggers for immune issues, and they're in everything. So we get so much immune exposure to that many of my patients, the broader elimination diet would be gluten, dairy, egg, corn, soy, sugar, alcohol. Now that's a lot more, but that's also a little bit more expanded to include the most common allergens that we have in the US.
Yeah. So you had candida overgrowth, and you also had SIBO, small intestinal
Yes.
bacterial overgrowth.
Mhm. And
Wow.
interesting, just in case there's someone listening who has Crohn's or colitis, we do a lab panel on a conventional lab with your conventional doctor called an IBD risk score. And what it does is it checks, among other things, anti-Saccharomyces antibodies. This is brewer's yeast, and it actually, if it's positive, contributes to a prognosis that's worse with Crohn's. When I started to really understand this, I found out that many, again, I'd say 80-90% of patients with Crohn's have an underlying fungal component. And again, it's tested with the antibodies, and that's conventionally indicated with severity scores. So this was part of my healing, but even in my patients with Crohn's or colitis, if they have any evidence on organic acids or on the blood work of antibodies to Candida or signs in the urine of metabolites of yeast or Saccharomyces, that antifungal kind of regimen, whether it's a low sugar diet, caprylic acid, indolysaic acid, oregano, I use all of those things in order to treat and heal patients from inflammatory bowel disease.
And that works with both not only Crohn's, but something like ulcerative colitis as well?
Yeah, so the main difference I find there is Crohn's is obviously systemic. So you could have, ulcerations all the way from the gut, the stomach to the end of the bowel. And there's more systemic manifestations, whereas ulcerative colitis is a little bit more localized. The up and downside is the localized ulcerative colitis often needs some sort of topical or enema type of treatment that's anti-inflammatory in that local area. But typically they both can be driven by SIBO and SIFO. And if you find the root cause, you can often reverse. I don't think I mentioned this, but 20 plus years ago, I was diagnosed with Crohn's. I was told it was incurable, and I don't have Crohn's any longer. There's no evidence of it. And that's something that the medical system doesn't really understand.
Yeah, and if you went back to the doctor who diagnosed, I guess you probably didn't do that, but if you did, they probably just blow it off and just not,
Right.
you
Oh,
figure
maybe.
they just yeah, exactly. All right, well, that is wonderful news. And toxic mold. So you also had a toxic mold exposure. And so if you could talk a little bit about that, as well as how common it is. I mean, in your practice, I'm guessing it's a lot more common, but I don't know if you have any data just on average, like as far as, I know there's obviously genetics, and I think not only, like 25% of people, I think, have the genetics that make them more susceptible, having difficulty clearing the mycotoxins from their body. But yeah, what did you experience? What do you see in your practice when it comes to mold?
So mold is super insidious. And let's frame this. Let's go out 30,000 foot view for just a second, because you and I deal with complex chronic disease, especially I'm the one I think it was Mark Hyman, our colleague, who said, I'm the doctor of last resort, the resort doctor, because he's like the one that people come to. And so I tend to see a lot of people like that too, that have been a lot of places and maybe the conventional system has failed them, and yet they still don't feel well. And I bring that up because the bigger framework is, I think the complex chronic illness is usually a combination of toxic load and infectious burden. So these old infections like Epstein-Barr or tick-borne infections or mycoplasma or these underlying infections in the site of a weakened immune system that's not keeping them under control, and then the toxic load. And I say that as a framework because toxic load in that bucket, of course, phthalates, parabens, pesticides, endocrine disruptors, glyphosate, Roundup, all these things we already talked about. But in that bucket of toxic load is mold and mycotoxins. Mycotoxins are just the chemicals produced by molds to protect themselves. These are smaller than particulate matter 1.0 or even 2.5, which is like a size of a virus. So they can literally go, when we inhale them, into our lungs. They don't need transport. They can go directly into our bloodstream through the alveoli. And that's significant because we could be for seconds, 5-10 seconds in a moldy building and start to have symptoms because it goes so quickly from the airborne sensation into the alveoli, into the bloodstream. It's very quick, and people can tell right away if they're exposed, if they're sensitive. So back to my analogy, toxic load, infectious burden, complex chronic illness, mold is a big deal because it's often hidden. People often don't know. They just know, ooh, I just haven't felt well since I moved into this house, or all of my family's been sick since we bought a new place or we moved to a new location, or it's often location-based, environmentally based. And often, although you said what the truth is, about 1 in 4 people have the genetics where they have innate immune inflammation related to mold that can cause all kinds of damage and side effects and symptoms and diagnoses. But usually in a household, some of the people are affected more than others, or the workplace. And it can be very confusing because you can have 1 or 2 that are like, I'm fine, no problems at all. And then you have a father and a daughter who are incredibly sick. And it could be respiratory types of symptoms. So chronic sinusitis, sinus issues, pain in the eyes, sore throat, trouble breathing, asthma, allergies, all of that. It could also be systemic. Probably the most common thing we see is just fatigue, brain fog, and cognitive issues. Now, this is relevant when you ask about statistics because Dale Bredesen, who does a ton of work with Alzheimer's and reversing Alzheimer's disease, he's one of our colleagues, both of us, and he talks about percentages, and he has been saying for years that 1 in 3 early onset dementia is related to mold. That's staggering. That's like 33% of people with early onset dementia, early meaning like 40s and 50s and maybe early 60s, not the classical Alzheimer's. So it's very significant. I was just with him a couple weekends ago, and he, for the first time, said 80%. His percent is going up. So I've been used to hearing him say this 30%. I was like, wow. And again, this is like younger people who are presenting with dementia and cognitive decline. And I say that because typically people who they come into their doctor and they might have a new diagnosis of Hashimoto's or Graves or lupus or all these things we talked about, or just their cognition isn't sharp, or they're waking up with a lot of pain, or they're having exhaustion and they have no cause. And granted, there's other things we look at, right? But if everything else is coming back negative, over and over again, the environment can play a role, and mold I see all the time. One of the questions I hear is, well, my grandmother had mildew in her shower, right? And is it mold really that big a deal? Or why is it worse now than it was 20, 30, 40 years ago? There's a couple of things. First of all, in the 70s, we knew that mold can grow in houses, and we started putting fungicides or antifungal, anti-mold substances in standard paint. So when you paint the inside of your house, it probably contains an anti-mold, a fungicide. That all sounds well and good, but what happened is just like what we've seen happen with antibiotic resistance as we give it more to livestock and to humans, and all of a sudden we have these super bacteria, super bugs that we can't treat. Mold is the same way. It's really smart, and it has outsmarted some of those fungicides so that when we have indoor microbial growth related to mold or water damage, very frequently it's aggressive. It's more, puts out more mycotoxins than we used to see. And if you think about construction nowadays, it's a lot of times more porous materials. Things are put up much more quickly, maybe a little bit less quality in some cases. And the surprising thing is a lot of people are having trouble with mold in new home, new construction. It's not always an old home.
Wow. Okay. So if someone just moved into their home like 6 months ago or a year or two ago, I mean, obviously, if they have any type of noticeable water damage, it could be a problem, but it could still kind of be hidden, even if even if it is new construction.
Yes. So I keep hearing stories. Of course, it's my world, right? So I hear all the stories, but things like they installed brand new cabinets and they drilled into the wall. They drilled right into a pipe. No one knew about it. And that pipe leaked into the wall for months or years until they realized that mold was growing behind the wall in their kitchen. Anyone who's ever had a leak under the sink, a leak from their fridge water line into the wall or near the fridge, a washer, a washing machine that leaks, a bathtub that overflows, a shower that wasn't properly installed. I'm seeing tons of, really, we think about grout as protective, but grout is porous, which means if you don't water seal and properly install a shower and the grout and the sealant, it's porous. It'll go right into that drywall and start to create a mold nidus. So all these things are, I just mentioned because I was like, oh yeah, well, I have one thing that I learned is a year and a half ago, one of my neighbor's fridge lines leaked into my wall down into my condo. We had a major mold issue. And ever since then, I literally disconnected the water line from my fridge. And I thought, it's not worth it. I make regular old ice cubes in the freezer, like the old fashioned way, because for me, it's not worth even having that water source that could leak in my wall ever again. And I probably, no matter where I go, where I live, I probably won't ever hook up my water line to my fridge in the future just because of that risk.
Wow, that's interesting. Yeah, we don't have that on our current fridge, so we don't have to worry about
Perfect.
disconnecting it. But uh, yeah, so at least I don't think so. We don't have like the water, like where you get the water from the
Yeah.
front. But I guess
Then
there's,
you're
I
good.
don't,
Yeah, that's it. It's
yeah.
like you can do it other ways. And people always like, I ask about air filters, water filters, because clean air, clean water, clean food is one of my things that I say all the time. And they're like, oh, well, I have a fridge filter. Fridge filters are not cutting it. They're pretty minimal as far as the kind of quality of filtration you want anyway. So I would never rely on that as your sole filter for water in your house.
So I use reverse osmosis. So what do you like?
Yeah, so we now know, I'm just going to mention because this is so significant. I'm in the state of Colorado. They recently tested our water supply a year and a half ago. Every single water body tested above the legal limits of PFAs. These are polyfluorinated compounds like Teflon, Gore-Tex types of stuff. These are forever chemicals, Dr. Eric. Like that means like the half-life we can't even calculate. I think 50 years is a way underestimate. So probably hundreds of thousands of years from now, we're still going to have these chemicals in our environment. I say that because if you're not filtering your water in some form, you are behind the game. You're getting chemicals in your body, guaranteed. Tap water is no longer safe. So then what do? Reverse osmosis, you can put whole house filters under the sink filters. Those are amazing. They're kind of costly. They take a little bit to install, and they do deplete minerals because as they're pulling out those chemicals, they also deplete the minerals. So you get a little bit more acidic product, but it's a great way to do it. You just need to make sure you get good minerals and that you're replacing those in your diet or as a supplement. You can now get some really good fridge or standalone countertop filters that do a great job and are less expensive for someone who's in an apartment or a condo or a smaller space. And nowadays, there's even these good filters that come in water bottles, so you can travel with that and take that with you. I always travel with a regular stainless water bottle with a filter inside if I'm going places, just to save on clean water.
How about spring water out of a glass bottle like Mountain Valley Springs?
Yeah, so as long as you know your source and they test for toxins and stuff, I think you're in good hands. The downside is, like I said, water supply here in Colorado from good mountain sources has already been contaminated with PFAs. But to your point, reverse osmosis is the best. Carbon filtration, which can be as simple as a handheld thing that you have in your water bottle, is pretty darn good for even PFAs and these other toxic chemicals.
And then getting back to the mold, do you test your patients? Like, do you do urinary mycotoxin testing? Do you have them test their house for mold? Doing like ERMI testing or, different type of like using the plates or like, how do you determine if mold is a problem? I mean, you probably know by looking at them, you've seen so many patients, so you kind of have a good idea, but I imagine you still do some testing.
Yeah, and this is the $1,000,000 question. I get it all the time. What's the one test for mold, Dr. Jill? Unfortunately, there's no one, but there's a little bit of a scenario that I can say. Number one, history is important. And even if you're just listening and you think, oh yeah, ever since I moved into this house or I changed workplaces. So if there's a story that you can tell that your change of environment caused you to become ill, especially if it's like maybe 6 months later, often if there's a little delay or a year later. And my example was there was a boulder flood in 2013. It flooded massive parts of the city. My office building was damaged, didn't really know it. And about 6 to 9 months later, I started having symptoms because there was mold growing in my office building. So that time frame fits really well with this kind of damage. But basically, history story is really important. You can online for free do a visual contrast test. This tests your visual acuity and tests the small retinal vessels in your eyes. And these little vessels can be damaged by biotoxins. And if you're having trouble with that test, you could be exposed to mold. That's one more thing. Those are just kind of free things: history, visual contrast. Then test-wise, I still do the Sears markers like TGF beta, MMP9, VEGF, MSH, and osmolality, and ADH, antidiuretic hormone. But those are a little bit trickier to interpret. They're innate immune markers, and they don't diagnose mold. So you need to see a pattern. But if you see all of those abnormal, plus a history of mold, plus an abnormal visual contrast, there's a likelihood that mold is in the mix. But what you alluded to, urinary mycotoxins. So this is not a perfect science. And I always just say that because people are like, oh, let me just test that. It doesn't always indicate exposure, but there are some caveats. There's 3 main labs that do testing: real-time labs, Vibrant Labs, and Mosaic Labs. They're all very different technologies, so you cannot compare one to another, and they all have different thresholds. And because this is such a new science, even the labs will tell you we don't really know what's toxic or what's not. Now, do I use those in patients? Yes, I do. And I use it as part of the bigger picture. But I wanted to just frame that because that's the easiest thing to go out and get done and say, oh my gosh, I have mold. And very well could be. But just because you have positive urinary mycotoxins, it could be you're excreting from years ago when you had an exposure. There are other answers. So it's a better idea to look at the whole picture and use that as part of your diagnostics, but don't just leave your home because you have a positive urine mycotoxin test.
Yeah, it's interesting what you said because I think it was Dr. Deal Nathan. I heard him say that he uses 2 tests. Like he sees, he has a practice where
Yeah.
mostly or all mold patients, and he uses real-time labs and Great Plains, which is now, as you
Yeah.
said, Mosaic Diagnostics, just because one isn't necessarily
Yes.
reliable. And yeah, so thank you
I
for
agree
sharing that.
100% with Neil Nathan on that. It's just like one of those things where it's so easy to go out there and be like, oh, I just tested positive. And there's so many factors that you want to take into consideration. And for example, say someone, I know we have mold, we've tested, and we'll talk about environment in just a second as well. And we have a urinary mycotoxin test is positive. We start detox. 6 months later, we test them and their levels are higher. Well, they start to panic. And I say, wait a second. We're measuring excretion. We want you to be excreting. I would actually expect in the first 3 to 6 months for it to go high. Now, sometimes it goes down, but sometimes because you're getting the body to get rid of a toxin that was stored in the tissues for the first 6 months or so. In fact, it's one reason why I don't usually retest right away in the beginning, because you're going to get these values that sometimes go up, and it's not always a bad thing if they're really excreting that toxic load. So you mentioned environment. I want to just mention that real quickly. Once again, it is by far the best to get an inspector who knows what they're doing. But so many areas in the US or even outside of the US don't have great quality inspectors that know what they're doing. So if that's the case, I still often recommend that patients do a dust sample. It used to be called ERMI, but ERMI is the data for ERMI, the way they do the diagnostics on that test is not very well validated. So the technical name of ERMI is called qPCR, quantitative PCR, meaning they check in the dust that you send in for DNA of mold in that dust. And that is actually a very valid technology. And what you're doing is kind of a historical snapshot of your home. I still do a qPCR in my condo maybe once a year just to kind of check in. I do it for my workplace. And I think it's a great place to start for patients who kind of want to know, is there maybe an issue? Now, say you have one that has loads of chitomium or a very high aspergillus score, you still need to find where that's coming from. So it's not the end all be all, but it is an affordable way for the average consumer who maybe is trying to figure out, do they even hire an inspector to start the process? And because I've seen hundreds of them, I often have my patients do that to actually look at that with them. And sometimes we can actually look at the types of mold that are in the dust of their home, look at their results, and actually, if it matches, it doesn't always, but you have a pretty good case for their exposure and where it might have come from.
One more question with mold. You
Yeah.
mentioned in your book super molds. What's
Mhm.
a super mold?
So some of these are classical molds, aspergillus, penicillin, it's where we get our antibiotics. These are not good. They cause allergies, they cause more sensitivities, they can cause inflammation. But there are some molds out there like Stachybotrys and Chitomium that are just really, really nasty. They secrete trichocythines, a type of mycotoxin that has literally been studied as a chemical warfare agent. It's been known to cause nephrotoxicity, that's damage to your kidneys, lung pulmonary toxicity, neurotoxicity to the brain and nervous system, and I could go on and on. Immune toxicity, almost every system can be severely damaged. Some of these mycotoxins have literally been used to develop drugs that are immunosuppressives for organ transplant. So, for example, mycophenolic acid is a mycotoxin produced by some of these toxic molds that is used to make a drug called Cellcept, which is used in organ transplants to cause no rejection. They basically shuts down their immune system. And this is important because it's not, the molds are bad enough. They're the spores and they're growing and they're throwing out these things. But it's literally, sometimes say you remediate a place and you have dead debris. If you had I always think of it like, say you had a dried flower arrangement and you either flicked it with your fingers or you blew on it and you shattered it into these pieces because it's dried and dead. You could have dead, dried mold debris particulate that can still stimulate immune inflammation, which is why it's so important to clean up after you remediate. But you can also have the production of the mycotoxins that gets stuck in paper and porous materials in your home or your clothing. And even though that's not the mold itself, and you might have removed the mold, if you still have those mycotoxins, those really toxic trichocythines hanging around in your home after you remediate or, whatever state of the process you're in, they can cause some very severe immune and other issues in your body.
And that's why some people have to throw out like all their books and stuff when they have a mold issue.
Yes, and I'm so careful because we have seen patients who go into panic. Now, there's a whole other side of this that's post-traumatic stress. It's so stressful to have mold, and mold, just the chemical reaction of inhaling it through your nose, can trigger a limbic or amygdala, the fight or flight system. So almost anyone who's had a significant mold health issue has a little bit of PTSD, and even if it's just the chemical inhale. And the reason that's important is because you really want to downregulate that trauma related to mold. And because there's a lot of online groups and stuff that say, walk out of the house, leave everything, sell everything you own, or get rid of it and go to the desert and avoid mold. Now, some really, really sick patients have gotten well that way. So mold avoidance is a real thing. And it is a part of my protocol because you're not going to get well with any number of supplements or IVs or protocols if you have a massive mold exposure. But the bottom line here is if you're listening, it doesn't mean you have to throw everything out. And I think that's really important. The worst types of things are porous materials like paper or books. And what I always recommend is if there's a question, you have scrapbooks or you have photo albums or you have a bunch of books, like I have a library behind me here. What I would recommend, if you consider those to potentially be contaminated, buy some plastic bins from Walmart or Target, put all of those porous materials in them, seal them, put them in your garage or somewhere out of your house, or if you're moving, and keep them sealed away as you're getting well. And then in 6 months or a year, you can open that up, see if you react, and you will know, I promise you, you'll either feel fine or you'll have immediate headache or sneezing or some issue. And that's a great way to not throw everything out. But if you feel like you need to kind of separate them out, you can put them in a contained area in plastic bins for a while until you're ready to take a look at those.
Okay, no, that's great advice. So people don't have to panic and throw everything out. Just put it in bins, get re-exposed in about 6 months and just see how you react then. So yeah, thanks for sharing that. Uh, any additional tips? I mean, you already gave a lot when it comes to reducing toxic burden in clean water. Just related to the mold you spoke about a lot, and the air filters. We didn't really talk much about that, but there's air filters. I imagine sauna. You recommend infrared sauna or sauna therapy?
Yeah, so what I would do, this can be overwhelming. Even listen to me, you're like, oh, Dr. Jill, I can't do all this stuff. Start with simple things. I always say clean air, clean water, clean food. Clean air, 80% of our toxic load comes from the air that we breathe. You should have an air filter at the very least in your bedroom. Ideally, you want a HEPA filter, which is the classical good filtration system that filters the larger particulate. But within that filter, you want to make sure there's a VOC, that's volatile organic compound filter, or particulate matter 2.5 or 1.0. Those are those really tiny particles. And usually that means the core of that filter has zeolite or clay or charcoal or some absorptive material. There's a ton of brands out there, but get a good one that has that technology. That's clean air. And at the very least, bedroom. Clean water, we talked about reverse osmosis ways to filter your water. You should be filtering your drinking water at the very least, even if you don't do a whole house filter. And clean food, choosing organic whenever possible, non-GMO, locally sourced, as close to home as possible. Grow some of your own things, even if it's just herbs on your balcony. All that kind of stuff at the very basic is super important. And eating things that don't have a lot of unpronounceable ingredients. So very basic whole foods is where it starts. And then other things you can add on: infrared sauna, a powerful way to detox. And you can either go to a gym if you have your ability to get your own sauna. A lot of times now you can get like a sleeping bag sauna or a little envelope sauna, the tent that you sit in. These are less expensive ways to use a sauna. Epsom salt baths, huge fan of those. I do them almost every night myself. That magnesium sulfate is a powerful detoxifier. Castor oil packs on the liver gallbladder can be incredibly helpful. All you need is organic castor oil and organic flannel. Put that on your liver, maybe a little bit of heat from a water bottle, hot water bottle, or something similar. And that's wonderful for the detox system. Lymphatic drainage, you can do rebounding, you can do vibrational plate exercises or technology. You can do dry brushing before you shower. And this is one of the reasons why the cold plunge is so popular, because it's wonderful for lymphatics. So even if you don't have a cold plunge pool, you can just end your shower with 30 seconds of cool water from your neck down, and that gives you the same effect.
All right. Well, thank you so much. Yeah, and one thing I should add, which I'm sure you agree with, which I don't think you mentioned, but just eliminate, or at least even if you have to do it gradual, as far as the cleaners, cosmetics,
Yes.
especially ones like if you don't want to switch all natural right away. I know it could be overwhelming, especially when you're focusing on the food, the air, the water. At the very least, what I would recommend is the products you're using on a regular basis. Like if you have a spray that you use every day, like if you're using 409 or whatever to spray the household, use a natural cleaner, or just on your own, like baking soda. You could just make your own concoction that doesn't cost a lot. But yeah, so definitely I agree with everything you said. And yeah, just I remember my mom when I was young, she had she would spray these air fresheners all over, and yeah, just
Yeah,
Yeah.
those are low.
Anyways,
You have those plugins or things like that. Not good. In fact, I won't tell you where, but a common area in some place where I frequent had these plugins, and I literally went, snuck around and pulled them out because I'm like, this is toxic. And people don't realize it. They just think they're freshening the air, but they're putting in VOCs, which are not good. Those are hormone disruptors too, those plug-in kind of air fresheners.
yeah. Well, I know we could go on for like easily like another hour chatting about this. Is there anything else that I should have asked you that I didn't ask you? Anything burning that, before we wrap it up that you wanted to say, or, any last words of advice for those dealing with, any type of chronic health issue or trauma?
No, Dr. Eric, I am just delighted to be here. I love the work that you're putting out in the world, and it's so great to be here with you. I would say if you're out there suffering in some way, shape, or form, whether it's autoimmune or cancer diagnosis, or even a loved one with early onset dementia, or you name the issue, there's always hope. And I just encourage you, you're already here, so you're actively learning about your health, but continue to just dive in. There's so many resources now for you. And sadly, we can't expect our doctors to do the prevention anymore. Our system is designed for calamity and stroke and heart attack and car accidents. It's not well designed to heal and help have us optimally thriving. So that's up to you. But we're here to help you, and just go out there and do the next best thing.
All right. And where can people find out more about you, Dr. Jill? If you could give your website, of course, where they could get your latest book, Unexpected, anything else that you want to lead them to?
Sure. So my website is just Jill Carnahan, JILLCARNAHAN.com. You can find podcast episodes, the book, online resources, products we love. Everything is all there. Blogs. I write one every week for the last 10 years. So any topic you want, you can search there and find it. If you want the book, just go to readunexpected.com.
Wonderful. Well, again, thank you. This was awesome. Appreciate you taking the time to chat about your health journey. And as usual, I always learn things, and I'm sure the listeners did. And again, yeah, thank you so much, Dr. Jill.
You're welcome, Dr. Eric. Thank you for having me.